Hello, friends. We are so happy that you are here with us today. And I spoke with Arnita the other day, and I warned her that I was not going to do a big introduction because her time is valuable and she already knows all the work she's doing. But we are thrilled. Before we started recording, my co-worker, Rhonda Stovall, gave a warm acceptance of how much we appreciate the work Arnita is doing. And then Arnita, I'm going to just keep it brief and let you tell us. We know you have a story that you want to share, but what motivated you to do this big project of being the director of the Office of Violence Prevention? It sounds like a lot of work, Arnita. And then you're going to have to unmute.
Yes. Thank you. Thank you so much for having me for today's Lunch and Learn. So as you already mentioned, I'm Arnitta Holliman. I'm the director of the City of Milwaukee's Office of Violence Prevention. I'm not new to OVP, although, I took the role in May when my predecessor, Reggie Moore, left. I was then appointed by the mayor as the new director. I had been in OVP for 2 years at that point as the recast program manager. And so just a tiny bit about my background, and then I can give you more, ask questions, you can answer questions, or I can give you more of an overview of what we do. But I am a licensed professional counselor by trade. So my background is in mental health field and trained in clinical psychology. I came to OVP after working with women in the street-based sex trade. So I ran a program for women who were involved in either street-based prostitution and or were being trafficked or had been at some point. And so we had drop-in centers through the Benedict Center, their sisters program, their drop-in centers and street outreach team. And so I led that program for a few years before I came to OVP as the recast manager. And I'll talk more about what recast is. And so leading that program, but then just in terms of my overall kind of background, I have worked in the field of mental health. So I've done clinical work, community practice, private practice, school clinic. I worked at prison for a few years. So in MSDF, I worked with women and men who were incarcerated, both individual and group treatment. And I've taught at most of the colleges and universities in the area. So either undergraduate or graduate level, like psychology courses. And so that, among other things, is what led me to being at OVP and then assuming the role as the director in May of this year. And so what led me to it, or what, to your question around why I'm in this role, I think given my background, my experience, I think this was a good fit for me in terms of, a next move, although I didn't come into this office with that intention at all. I didn't see that, in the stars or the pictures or any of that. But it made sense. I am extremely committed to not only preventing violence in our city, but also seeing people heal, helping people heal. And so that's one of the core shifts in just how we do our work that we're doing as we move forward.
Thank you for that. And I was wondering, as you are looking at the state, as one of our participants said right away, we're concerned about what we're seeing in terms of letting people vote, democracy, encouraging youth. And one of the people who's a participant is going to also be a presenter in March. And we're so happy that Gloria Pitchford-Nicholas will be joining us. And one of her themes is going to be, how do we encourage youth? So you're looking at mental health, you're looking at really people not being very loving. You're looking at the impact of COVID, or whatever we're going to call it, the pandemic. But when you tie all that in, what are the things that you are most proud of right now as you step forward?
One of the things that I'm most proud of is that I'm hearing the language more now around mental health and healing, and really for folks who are focusing on either getting or staying mentally well. And so I think we've had this conversation for, over time. However, I think people are moving towards really prioritizing, or at least considering, what impact does our mental health and wellness play on our lives. So be it through our work, our personal relationships, family, community, any of that. And so that's one of the things that I am happy about and excited about, even as we do the work within OVP, and focus on mental health, healing, wellness, trauma prevention, in that work. So
And so as we look at the young people, it sounds like you've had so many experiences, and we're seeing violence in Milwaukee that the record is being set. I don't know if it's 2 years in a row that we've had more violence, but we don't want that to be how our city is viewed. But do you think it's more coming from the very young? Is it coming from the 20s? Where do you see this situation developing? And I know when we talked on the phone, you said there were a lot of social determinants that have impact. So which one of those do you want to go for?
well, we typically assume that it's younger people committing acts of violence, but the data over time has shown that it's usually adults, right, that commit the majority of acts of violence. However, the unfortunate thing that we've seen through this pandemic, so last year and this year, is that the numbers are skewing lower in terms of young people that are both perpetrators of, say, gun violence, as well as victims of gun violence. And so we're concerned about it regardless of the age. However, it is definitely concerning that we're seeing the numbers skew lower for young people that are killed, injured, or again, are perpetrators of gun violence, or any kind of violence for that matter.
When we are thinking now about even driving through certain streets, and I heard a story about a month ago, the danger of being a pedestrian and how this is impacting people of color more than people who have their own car or their own white privilege or more assets to not be a pedestrian, or even the neighborhoods that they allow cars to travel more than 25 miles per hour. Sometimes I'm scared seeing young people as pedestrians, or seeing people who I don't know if they have a driver's license and they're, in the right lane and they're cutting people off. And even violence by autos.
So actually, President Johnson and soon to be acting Mayor Johnson just had a press conference this morning to address the issue of reckless driving and car thefts that we know community members are feeling the pain, the loss, the concern around, how people are driving in the city. And so OVP, in terms of our partnership around that, is, working with youth serving programs that provide kind of primary prevention programming to hopefully stop a young person from making a decision to steal a car or to drive recklessly. And then also to provide programming, education, and support to young people who may have already been, in a stolen a car, or driven recklessly on city streets. And we understand that it is a serious issue, but it also takes a multi-pronged approach, which is any of the work that we do in violence prevention. OVP and our work, we can't do it alone. And so it's important that, it's an all hands on deck issue, be it reckless driving, gun violence, domestic violence, child abuse, sexual assault, any of that.
And in our chat, I thank Mary for this question. Does OVP have a strategic plan for preventing violence? In the past, what have been OVP's, and everybody knows that means Office of Violence Prevention, most successful initiatives?
So I have a little PowerPoint if you want me to go through it.
Let's do it.
Okay, yeah, that might answer some of the questions. It may spark new ones, but it may also answer a few
That
questions.
sounds great. And then we will encourage people who are able to put it in the chat to put their questions in the chat. And phone call 414-731-8587. If you're able to mute, that would be great. So,
Oh, I'd be happy to, sorry.
oh, you're fine. Okay, now I'm going to hit share screen.
Okay, well, I'll share my screen. So if
Okay,
you
so
want to
you're
stop
probably
sharing.
better. Oops. Hold on. That was a big oops.
Okay.
Okay, my technology friends, how do I stop
Okay.
what I just did?
You have to go to the top of the bar, and it's gonna,
Stop share?
yes.
Okay. And how do we empower Arnita to share?
So I believe
You should be able to share
I
her
should
screen.
already be ready to share.
Oh,
my
cool.
screen.
Okay, great.
So can everyone see it?
Yes, perfect. Thank you, Arnita.
And now, are you able to see the actual slides?
Yes.
Okay. So OVP, we're a part of the city's health department. And it's important for, we try to make sure that folks understand that we are a part of the health department partially because, or mainly because we understand that violence, is a public health issue, a public health crisis. And so we address it as a public health issue. I like to level set and just make sure we're all on the same understanding in terms of violence and what it is. And according to the World Health Organization, it's the intentional use of physical force or power, threatened or actual, against oneself, another person, or against a group or community that either results in or has a high likelihood of resulting in injury, death, psychological harm, maldevelopment, or deprivation. And so our office's mission is to prevent and reduce violence through partnerships that strengthen youth, families, and neighborhoods. And a few of our initiatives are the, Commission on Domestic Violence and Sexual Assault, Safe Visitation Exchange Center, Recast Milwaukee, the Trauma Response Initiative, our suicide prevention work, 414 Life, our general youth engagement, and the Blueprint for Peace. And I'll go into each of those a little bit more. This is one of our, diagrams and kind of how our work extends. And so we focus on youth, families, and community. This diagram is changing a little bit because while it encompasses all of the work that we do, one of the things that we are shifting toward is centering that trauma prevention and healing piece throughout all of our focus areas or all of the divisions within our office. Some of our milestones. So the Office of Violence Prevention, which often people don't know, it was created in 2008 by Mayor Barrett. And it's been in existence for 13 years. However, the first 7 or 8 years of the office's existence, the office focused primarily on domestic violence and sexual assault. In 2015, there was a significant rise in the number of shootings, so gun violence. And so after that rise in 2015, in 2016, the mayor appointed my predecessor, Reggie Moore, as the new director of the Office of Violence Prevention. And from there, our office, we increased in terms of our scope and capacity. And the number of folks in our office. And so in 2016, we expanded again. There were a number of things happening in the city. There was the murder of Will Smith, the Sherman Park unrest was in 2016. That's when the planning process to launch the Blueprint for Peace, or the development of the Blueprint for Peace, was started. In 2016 also, in 2017, the Blueprint for Peace was developed. And the Blueprint for Peace really is a document that it was created from, and not with a top-down approach. So it's not, a mayor's document, it's not a health department or a city leadership document. This is a document that was created from the voices of community members, both adults and youths. And they responded to what is going to make the difference so that they have a healthy, thriving, safe city. And so the development was in 2017. There was an expansion of the trauma response team. I'll talk a little bit more about each of these kind of things a little bit later. Later in 2017, the blueprint was launched. There was also the launch of Recast Milwaukee, and Recast is Resiliency in Communities After Stress and Trauma. That was a 5-year grant from the Substance Abuse and Mental Health Services Administration, so SAMHSA, federal, a part of the Federal Health and Human Services. That was a grant that we received from them for 5 years. And so we received it beginning in 2016, but the programming really launched in 2017. So 2018, again, TRT, the trauma response team, expanded from not only the police department providing referrals, but then to the fire department as well. There was the Safe Summer programming funding that we were doing with Recast Milwaukee, and in a number of other things that were happening around the city, but also the launch of the Coaching Boys to Men pilot, which is a program that focuses on coaches of youth athletes and focuses on education around sexual assault, sexual violence, and the prevention of it. 2019, the 4-1 for Life partnership was established with Freighter and the Ascension. Again, I'll go kind of a little bit more into these in a moment. So a number of things in 2019 and 2020. We, of course, there's the pandemic, the global pandemic with COVID. There was the unfortunate mass shooting at Molson Coors. There was a mass shooting at Mayfair Mall, also mass shooting on 12th and Locust of a family. So a number of very horrific events that happened during 2020. Also the protests for justice after the murders of George Floyd, Breonna Taylor, Joel Acevedo, and other folks around the country. And then during that year, we also learned that we had the award for Safer Communities Youth Grant that would begin focusing on expand our focus within our family violence prevention division to expand to also include child abuse prevention and bullying prevention. So 2021, again, there was more expansion within our family violence component. And we were then awarded, so we wrapped up the first 5 years of the Recast grant and learned that we applied earlier this year, learned that we awarded another 5 years of Recast from SAMHSA. It's $1 million a year for 5 years, so a $5 million grant. With the medical college, our partnership with the medical college, not only were we partners in terms of the freighter piece and the hospital portion of the 4-1 for Life, but then we RFP'd the 4-1 for Life program, and the medical college won that award. And so they are the implementation partner of our 4-1 for Life program. And so also there was a task force launch for the unarmed first responder efforts. And I'll mention that again in a little bit. Our blueprint for peace vision. And I'll put a PDF copy of the blueprint in the chat, as well as the website link, so everyone has that. So the blueprint vision is, Milwaukee's a safe and resilient city where the lives of all residents are valued, promoted, and protected. The blueprint has 6 goals, 30 strategies, and over 80 action items. The goals of the blueprint, the goals that came out of this blueprint development was 1, stop the violence, stop the shooting; 2, promoting healing and restorative justice; 3, supporting children, youth, and families; 4, promoting economic opportunity; 5, fostering safe neighborhoods; and then 6, strengthening capacity and coordination of our violence prevention efforts through our partnerships, both system partners and community partners. We focus on 10 priority neighborhoods. So the priority neighborhoods are listed, and those priority neighborhoods are based on data around violence. And in those particular neighborhoods where you see higher levels of violence, be it gun violence or of any sort, you'll also see higher levels of poverty and other systemic issues within those same neighborhoods. In terms of our work is sectioned into a few different focus areas or divisions. So there's the family violence prevention piece. The team that works on the family violence prevention piece, they convene the city's commission on domestic violence and sexual assault. There are over 60 partners, both system, community organizations, other folks that are a part of the commission. As a part of that family violence prevention work, there's a safe visitation and exchange. We are able to provide funding around safe visitation for children and exchange between parents through, again, a different federal grant. There's focus on teen dating violence, bullying, child abuse, and then some of the annual things that we do, the Denim Day and Love Without Violence conference. When we think about violence and violence prevention, one of the areas we talk less about, or at least I hear people talk less about, is around suicide prevention. And that's self-directed violence. And so our suicide prevention division provides question, persuade, refer training. So these are suicide prevention trainings, and those trainings are provided to community organizations, faith communities, other system partners. So that we're providing those trainings. We also do gun lock distribution through a partnership with Milwaukee County. So we're distributing those gun locks. Over 10,000 gun locks have been distributed this year alone between January 1 to date. There are a number of suicide prevention events and awareness things that we've done, including a Summer of Healing series that both focused on domestic violence, sexual assault, as well as suicide prevention. We're part of the opioid post-fatality review. And so that what this team does is reviews, and this is again, system partners, but what this team does is review folks who have died as a result of an opioid overdose. And so reviewing the situation, the circumstances, but also doing the follow-up and kind of wraparound support for the family survivors after that. Additionally, Vanisha Kendrick, who leads our suicide prevention work, is also a part of the suicide review committee. So similarly, this review committee reviews suicide that happen in the city or county of Milwaukee, and really taking a deeper dive and look at the circumstances with a prevention. We're always, for OVP, we're always looking at everything with a prevention related focus. What we're doing with our expansion or ARPA funds that we've received from the state is expanding that suicide prevention work. So we'll be hiring another person to work in that suicide prevention area and really expanding some of our work around the overdose prevention, and not just opioid, but just overall overdose prevention. There's the youth engagement and violence prevention piece. We lead or convene partners that are a part of the Beyond the Bell coalition or cohort. So these are youth serving organizations that really do the work of lifting up the programming and support for young people. There's a Coaching Voice to Men program or training that I mentioned earlier. There's a Credible Messengers partnership. This is a partnership with the Milwaukee County, DHHS, and the Division of Youth and Family Services, DYFS. And so 5 partner groups, including 414 Life, are part of this Credible Messenger partnership. And so they work with young people. Most of their referrals come from they are justice involved young people. So they have already had some involvement with the justice system. And the goal, and these are young people that either have been victims of gun violence, they are at risk of being a victim of gun violence, or they are carriers of guns or have been involved in some type of gun violence, or that risk. So either or. The majority of the referrals right now come again from the youth justice system through DYFS. Also, we're part of the carjacking and reckless driving task force that Alderman Murphy created some time ago. The recommendations have been out for that, but also, again, from this press conference this morning, we're partnering with other city departments to address the issue around carjacking and reckless driving. The healing and trauma prevention piece, and this is where I started out, and OVP is leading that work. So recast, again, resiliency in communities after stress and trauma. The focus is on youth ages 12 to 24 and their families. And so again, we prioritize the 10 priority neighborhoods. However, we serve the whole city with all of our work, but prioritize those neighborhoods and those who are most at risk of experiencing trauma. So providing support resources, we support programming through funding. With that, we have over the last 5 years put, millions of dollars back into the community from grant funds we've received to support youth serving organizations, parenting. The parenting networks are working with parents, but also the healing and wellness piece of it. So respond when someone has been a victim of violence or survivor of violence, if they need additional support, emotional support, grief support, any of that, we're able to get them connected to culturally competent providers in the community. The trauma response team is a partnership between the City of Milwaukee Office of Violence Prevention and Milwaukee County. And so that team is a part of, while we funded, it is a part of the county's wraparound system and their crisis mobile team. So they're a special unit within the crisis mobile team. They focus on young people ages 5 to 17. So if a young person has been exposed to something traumatic, something potentially traumatic, a referral can be made to the trauma response team. Again, that started out where we trained the police department to do referrals, then it expanded to the fire department, and now anyone in the community can make a referral to the trauma response team. We are also a part of the Child Death and Homicide Review. So CDR, the Child Death Review, I lead facilitation for those particular reviews. And so we review whenever a child dies, but also specifically a separate review for child homicides. Again, not only looking at what were the circumstances, but also how can we prevent something like this from happening to another child or young person. And then, OVP also leads the trauma-informed care trainings for the City of Milwaukee staff workforce. So commissioned by the council for city staff to any city worker that spends 60% or more of their time interfacing with the community is required to be trained in trauma-informed care. And so OVP has led providing those trainings and, working with contractors or consultants to provide those trainings for city staff. In our community violence prevention piece, we got a number of initiatives: the Sherman Park Build Health Challenge, the ACER, and ACER is really using a known framework. So you've heard of adverse childhood experiences. This is adverse childhood experiences and resilience. So adding that resilience piece of it. And so we're looking at a part of that work is really building capacity within neighborhoods and communities around the support that they need, but also their capacity to do community organizing and all of that. And so if they have the support that they need, what kind of changes do we see in those particular neighborhoods within the community? There's the Community Intervention Task Force, which was previously named the MPD Diversion Task Force. Again, this was commissioned by the council, so Alderwoman Coggs, Lewis, and Alderman Kovac. And so this partnership or this task force can include system partners, so OVP, the police department, the county, and a number of other partners and a few community members. And really we're looking at what can be done to address responses or calls for service that are not, that don't require a police officer to respond. So these may be mental health related, they may not, but we're looking at what's happening across the country. What are other cities doing? What are the best practices? And what can we do? And so we'll come up with recommendations that we will provide to the council and the community around what we think the best course of action is in terms of Milwaukee creating an alternative response. And this was because of a cry from the community as well, and not just in Milwaukee, but across the nation, where communities and activists have called for defunding police or definitely reform around responses to calls that we hope don't lead to someone being injured or harmed or unfortunately murdered. The blueprint for peace adoption and implementation training. So part of that is, making sure that folks understand, the blueprint, know what it is, and adopting that as a part of their work, their language, and really how they do their work within the community, and understanding that we all have a role to play in violence prevention. And then there's 414 Life. And so 414 Life is a program of the Office of Violence Prevention. However, we contract that program out to a partner in the community. For the first 3 years, our implementation partner was Uniting Garden Homes. And so earlier this year, we RFP'd the project. And so again, the medical college, their comprehensive injury center, which is led by Terry DeRoon Cassini, who's the woman there in the glasses. So they won the contract. And so 414 Life is now within the comprehensive injury center at the medical college. This is also where my predecessor, Reggie Moore, is. He leads their division of violence prevention around policy and engagement. And so what 414 Life does, they do outreach within the community. They do mediations and violence interruption. There's a hospital response that's a part of the partnership with Freighter Hospital, Freighter Medical College in OVP 414. There's Credible Messengers, again, the Credible Messengers program. So not all of the 414 Life team are a part of the Credible Messengers, like in terms of on that Credible Messengers team, but a portion of the team work also on the Credible Messengers team in terms of addressing, or preventing violence with youth. Then there's the case management piece. So 414 Life is doing the work of stopping retaliatory violence. Often when someone is shot, there is a possibility of retaliatory violence. Sometimes people will explicitly say that they want to retaliate. And so that's what this team is working on, to make sure that the retaliation doesn't happen. They're also doing proactive outreach in the community. When there is a shooting in a particular neighborhood, they'll do a shooting response. They have pop-up events in the community. The hospital responder gets a page whenever someone is shot. And so we started out at Freighter, which is the level 1 trauma center here. And so started out with Freighter and then expanded to Ascension. So she gets a page when someone's shot, and then she's there at the hospital meeting with that survivor, as well as their family members, but really working with them to provide case management, to provide them resources, but again, to support them and make sure that there's not another incidence of violence. And so that's a part of kind of that case management piece. Just in terms of our overall community engagement, there are too many things for us to list in terms of the ways that we have engaged and continue to engage in the community. And so sometimes that is specific community events. So we may be hosting a table at Juneteenth or some other kind of event in the community. It may be situations like providing grief support after a shooting. So at Molson Coors facility for the employees, at the time I was able to put together a team of therapists relatively quickly. And we went in for that next week when employees returned to work, to provide them grief support, resources, and to be there for them during that time when they were returning. Grief support at Nova High School after a young person was shot. This was so unfortunate. In 2019, that summer, there was a Day of Love. And so there were all of these amazing events around the city that were happening simultaneously. And one young person, Tay, she helped to plan the tournament, a basketball tournament at Moody Park. And then that very next day, on that Sunday, she was shot, hit in the crossfire, and killed in that same park area. And so the school connected to it, which she also attended, we provided grief support to students there. And so again, too many things to kind of go through, but you can always go to 414life.com. So that's our website. You'll get a snippet of the Blueprint for Peace there, but then I'll also again put the PDF document, which gives you the full blueprint, in the chat. And you can always reach out for a hard copy. We have plenty of hard copies, and we're always happy to share them when folks ask for them. Yes, thank you, Miriam. Thank you.
Oh my, we talked about whether it would be a good idea to have a presentation in such a formal way, and she is so organized with so many events happening. So Liddy, do you want to unmute and take the first question?
There we go. Good afternoon. I know you shared a lot of programs, and I'm glad you're working with that parent piece. But how amenable or hard it is to reach people with these programs? Are they welcoming you to work with it, or are you having a hard time reaching folks?
So I think it's important for the community to understand our role in the work. And so we don't provide direct service. And a lot of times people think that OVP provides direct service. We work with partners, both our system partners and community partners, to provide those services. So in many cases, we are providing the funding for those services. And so we're working on many levels in terms of not just supporting the programs that are working directly with people in the community, young people in the community, but also working on the systems level. And so that means working toward, policy and systems change and how things are done, and to really address some of the systemic issues that lead to violence. But we don't provide the direct service. I don't know if that answered your question, but no.
No, but that's I
Yeah.
hear what you're saying.
Yeah, and so sometimes
I'm a crisis worker for Running Rebels, because that's what I wanted to see.
Yeah. Running Rebels is one of the programs that
so I'm wondering what data you're getting on that part. If you were getting that data, is there pushback? Are people being amenable? I was wondering if you're collecting that data.
So we do collect outcomes, and so we're not collecting data that would get at, do people want the programs, or how are they accessing the programs, to answer that question. But we do collect program data. And so you raise a great question, though, because there's always the issue of access. So who has access to what programs, who knows about them? And so making sure that community members are aware of programming and that they have adequate access, that is extremely important part of this. But yeah, we don't collect data in terms of, and let me take that back. So with the trauma response team, we do look at how many referrals are actually made versus how many families accepted the referral. So we get it on that end, but not for every program that we fund.
So Arnita, I taught for 39 years at NATC, and I taught child development and professional development for the new faculty coming in. And one of the things we cared about is the impact of lead poisoning on very young children. And one of my friends on this call actually made that connection when she referred to the person who drove the car into the Waukesha parade. And she said, I wonder what happened with this person as a child. Is that part of lead impacting a person's life? Your thoughts?
So I have no idea if that person was exposed to lead poisoning, or if that was a part of his history. What I do know is that when we review cases of deaths, homicides, suicide, any of that, what we know and generally suspect is that there's something along the way that perhaps was missed in terms of support or services that young person or that child needed, that may have helped to prevent them from making the choice that they did, committing the act that they did, or being involved with other folks that may have led to something that was harmful to them.
And another question I have, then I really want to open it up to other people. It was listening to a show on public radio that talked about people don't want to trust the police to give them any information. And that's understandable. There are a lot of people on this call who've been working on issues for the police too. So I'm going to open up for them to have their voice.
Yeah, I think that is, I know it's a significant issue, but I understand why the issue exists, right? So if we look at this country's history, as it relates to police and community relations, if we really, understand the history, we understand that the entire policing system department was really born out of the slave patrols, right? And so when you have something that was born out of slave patrols, you have to understand how embedded some of the racism, white supremacy, and privilege is embedded in the work and the culture. Do I think that that can change? Absolutely. Do I think that that takes intentional effort and time? Yes, it does. And so I think what we've seen so far of our current, chief, I've seen personally his work and his commitment to community engagement, community oriented policing, which is extremely important. But at the same time, we have to balance both understanding that we have a responsibility to keeping our cities, our community, our homes safe, and at the same time feeling safe when we are engaging with people within the law enforcement or the criminal justice system. And so that's a history, an experience, and a knowledge that we understand as folks of color in this country, not just in this city. And so these are things that we have to continue to grapple with, but that we can work together toward a better end on.
Thank you, Arnita. It's an open time, so if you raise your hand or unmute, I will call on you. I'm especially calling on the people who've been working on this issue. Oh, Gloria.
Oh, thank you so very much. I certainly did enjoy and learned a lot from Arnitta's presentation, and really thank you for that. My question is along the same line as Pat's when it comes to community policing, and that's kind of the new buzzword, looking at what changes might impact how we perceive and see the police currently. But my question really stems more from the mental health aspect. I know there's been conversation along the way that perhaps there should be experts in the mental health field that are assigned to various police officers and that potentially would go out on calls and so forth that might be significant in resolving the issues. Is that a conversation that's going on currently with the new police chief?
So some of those things, are already happening. In terms of, the community oriented policing, the community engagement piece. So we're doing work around that. Jamal Smith in our office leads OVP's portion of that work. But also, in terms of, mental health professionals going out with police. So that exists within the CART team. And so the CART team is a partnership between the county behavioral health division and the Milwaukee Police Department. They are looking to expand that, or currently working on expanding that to the sheriff's department. And so those are instances when someone is in a mental health crisis. The CART officer, so this is the officer that has a little bit more training around, just understanding mental health. They will go out and accompany those therapists in the community to respond. There, I think, are some things there that definitely need to be sharpened. And so one issue has been just around availability and the lack of having enough CART teams available. But also it's also around the racial equity piece and the cultural competence, right? And so these are issues that are being addressed. These are things that we are also considering And the CART team won't stop, and that their expansion won't stop. But the county is also a part of this community intervention task force, and so these are all of the things that we're looking at. Like, how can we do these things more efficiently? Make sure that people receive the services that they need, but they are not harmed in the process.
And I see Barbara has her hand up. You have to unmute.
Okay, I'm coming. I'm working on it. Just listening. Thank you. This is so impressive. And I remember when Reggie Moore was with us about 3 years ago, and I had that 414 book that Mary Ellen held up. That's great. And now you're doing so much more. And that is just so fantastic. So I have a couple things. First, one little sort of mundane question. How many employees are there with the OB?
So within OVP, so we're a relatively small team. We currently have, include myself, so there's 7 of us. We have three vacancies right now. And we're looking to expand our team with ARPA funding that we received from the state. So we will expand both our youth division, the suicide prevention work, in terms of team members, and we'll add a couple more team members around just kind of the some of the other kind of administrative and financial stuff that we have to do. And then we are also expanding the 414 Life team through ARPA funds from the city. And so to expand that team of violence interrupters and outreach workers and hospital responders.
Okay, that's what my other just deeper question is about the violence interrupters. And try to understand, you said you talked to victims and their families and things and try to prevent it from going to the next step, retaliation, revenge, that sort of thing. What kinds of things are most effective in that area, or is all very different? How does that go, those conversations?
Well, it depends on the situation. What we do know is that it takes someone who's credible to move the needle in those conversations. One, to even have access to get in contact with someone and actually have them respond or be open to having any conversation or mediation. But then also, so the 414 Life team consists of folks that are considered credible in the community. And so for some of them, they have lived a life where they have caused harm to the community, but they are not only have they, stopped that activity, but also they are doing tremendous work to stop others from doing it. And so they have a level of credibility. There are other folks, not everyone on the team has, committed crimes or had or spent time, incarcerated, but some of them have. And either way, they have close ties to folks in particular neighborhoods, a part of particular organizations. And if they don't have that connection, they typically know somebody that does. And so their credibility is an extremely important piece of having those, conversations and to have those mediations. And so they've done amazing work in terms of stopping retaliatory violence, in terms of mediating, and even, at some points getting what's called, a ceasefire. And so between groups, when there's retaliation, really getting them to the table to really work with them to agree that they aren't going to continue like shooting between each other.
That's great. That's helpful.
Thank you. And so there's some interesting information in the chat. Ann Batista says that it's hard to download this.
Yeah, it's a PDF
blueprint
document, but Pat, I will email it to you just so that you have it. And then I don't know if so someone mentioned they'd like a hard copy. So either they could send us their information, or I could send Pat you several copies, whatever works best.
That's great. Thank you. And good, Lorna. Lorna, unmute, please.
Thanks for the article as well.
Hi, Arnita. I was going to ask if I could have a hard copy of that too.
Oh, yeah.
It just seems so much better than what I can print out, and I love to read things and go back to it and use it as a resource. So, and I know that we recently spoke with Fred Royal, and he was talking about using the Blueprint for Peace as a model for creating a community-wide safety plan. And I wonder if you could tell us a little bit about what is going on in that regard and how your office connects with it. So I know that the Community Collaborative Commission has been tasked with starting this safety plan. So just, full disclosure, our group was, I am one of the members of the Police Policy and Practice Reform Committee that I know that Pat's been referring to a little bit. And we started our group back in summer of 2020 after George Floyd saying, in a sense, what everybody was saying, enough is enough, and what can we do about this? And so one of the important things that our group has done is create something called the Fire and Police Commission Review. And I believe your office, and maybe you specifically, were actually sent a copy of that report. And they have been meeting recently with the Police Chief Norman and a couple of his staff. They've met with a committee of the Fire and Police Commission. I believe they gave a town hall meeting at the NAACP last week, and they're going to do more work to further the advocacy for the recommendations made in that report. And so this same group was going to do what we call in the League of Public Issues Forum, where we would be trying to educate the general community about what is a community, wide safety plan, and also engage a lot of organizations in the community to do that with us. But since that happened, we've been made aware then that the CCC has been tasked with actually starting work on that. And they are supposed to be having listening sessions throughout various communities, and coming together with, what do people need, what do people want, and how would the safety plan look? So I just like your thoughts on that safety plan and how important that is to the work that you do, and how you are connected with that work. What is the role? Because one thing I know Fred said, and we've all said, it's a lot of people working in silos. So how do we get them all to work together and under sort of that umbrella, let's say, of a community safety plan?
Yeah, so we're already a part of the CCC. So Jamal Smith, again, in our office, leads that work for OVP. So he's a part of all those meetings and convenings and doing that work that the CCC is doing. So that's really how we're showing up in as a part of that work. I don't know if I've seen a more recent review. You said the fire and police review.
It's a report that our group put together after almost a year's research to say the Fire and Police Commission is a very powerful group with a lot of oversight responsibility for both departments, and then we can focus on police. And so they were making a number, I think 20 some recommendations for what the Fire and Police Commission can do to change things that would make a more effective police department with better oversight and transparency as well.
Yeah, I don't know that.
If you go to the League of Women Voters website,
okay, I will go there and take a look at it, because I have not reviewed it.
Yeah, it's right on the front page. I think you might be
Okay.
interested in that.
Okay.
Could I ask one of the league members to put it in the chat?
Oh, that would be great.
And I don't want to call on Barb Notstein, but I keep looking at her name, hoping she'll unmute. No pressure, Barb.
Thank
No
you.
pressure, Barb.
I had very significant technology problems up until a couple of minutes ago, so I'm sorry I missed most of the meeting. I was the co-chair, I am the co-chair of the police practice. I'm sorry, Lauren, I don't quite remember the whole name of our committee. But anyway.
The PPPRC, because it's too long. Okay.
Well, thank you. We have several members of the group on the Zoom here today, and we have worked very, very hard on the report regarding the Fire and Police Commission. And we have 26 recommendations and would very much love to sit down and talk with you about them at some point. The purpose of studying the Fire and Police Commission was really to look at how to reform the Milwaukee Police Department, because the FPC is the governing body and determines the policies, the hiring, the day-to-day practices that the police department implements. We wanted to look at the commission that has that responsibility and find ways that they could have more power, exercise more power, and be a greater influence in changing the way the police department operates, including looking at reduction in inappropriate use of violence. One of the things that we talked quite a bit to the NAACP and, well, both the police chief as well as the FPC about is the very significant lack of diversity on the police force. And we did quite a bit of research that demonstrates that inappropriate violence between community members and the police will be significantly diminished when a force better represents the diversity of a community. And so we see all of that as very much connected to how we can create a calmer, more peaceful community, and would very much like to talk with you further about that.
Yeah, I would definitely like to talk further about that. And I agree that the racial disparities or lack of diversity in terms of the overall police department is definitely an issue that has to be addressed. And I think that when we look at racial equity and look at who's serving whom across any of the partners or systems, that's extremely important. It's the same thing in terms of mental health care and the response within communities for providers, be it crisis or otherwise. It's the same thing in terms of programming, all of those things. And for most programs, for most systems, they are not culturally specific. And so that makes a difference, right? And so not everything is you can't have everything that's cookie cutter. It's not going to work or reach everyone. To one of the earlier questions around, if people accept services or not, like how are they provided? How are they marketed? What do the service look like? What does that feel like for folks? And this goes back again to also the trauma-informed care piece. I have a whole soapbox about the trauma-informed care. It's not just about being trained in, moving from, what's wrong with you to what happened to you. It's also what happened to you, who's responsible for it, who needs to be held accountable, and then what do you need to heal? Those are significant pieces or next steps in the trauma-informed care piece, but also trauma-informed care isn't just about what happened to you or what services are provided. It's all the little things in between and practical application. When you go in for services, what does the office look like? Who greets you? How are you greeted? Do you have signs that say all the things you cannot do versus something that's more welcoming? All of these things are, when you are engaging with a system partner or a program in the community or law enforcement or the justice system, how are you greeted? How are you cared for? How are you supported? And so language matters and all of that, in the same way that we consider language around, our preferred pronouns, right? So she, her, hers, are my preferred pronouns, but also what's the language that's appropriate for engaging with me in a way that will, lead me to want to accept services and also to, provide whatever in instances where information you need. I mean, so, and back to the earlier question around or statement around people not wanting to engage with law enforcement or share information with them, there are other options. So there's Crime Stoppers, which, we're a partner, NPD is a partner with Crime Stoppers, but we're a partner with Crime Stoppers as well. And so they offer rewards for people to anonymously report crimes. And if it leads to an arrest or a conviction, I can't remember which one, but then they can get a reward and they remain anonymous. So there are other options. But with all of that, we do have to look at the racial dynamics, racial equity, and the diversity, and we can't get lost. Because this is what happens often with, diversity inclusion, is that it's all the things white male normative, right? And so then everything else is diversity. And at the end of the day, the folks who are most impacted, who are most harmed, get lost in all of that. And so when we look at communities who are experiencing the highest levels of gun violence, it is primarily Black folk in the city of Milwaukee. Also, it's also primarily, Black folk who are shooters, but that does not mean that, it doesn't mean that, we don't look at this in a stereotypical way that, Black folk people are just folks who commit crimes. It's people who live in communities and in neighborhoods who have been oppressed systemically by systems, redlining, lack of quality education, quality health care, either poor access or lack of access altogether. All of these things, poverty, all of these things create conditions where you see higher levels of crime, right? And people just in general are going to harm the people that are closest to them. We are typically around people that look like us, right? And so typically people will harm the people that are closest to them. It is about proximity. However, within all of that, we need to look at what are the systems that need to be changed? What are the policies that need to be changed? Where are resources going? When we think about budgets, a budget is a moral document. And if budgets do not prioritize saving lives, healing, and providing people the support and the resources that they need, then what exactly are we investing in and what do we really care about? Because where our money goes tells us what we really care about.
Thank you. Lorna Grady has another point, and I do want to point out that Brandy Rodriguez has put in our chat a link to the PDF on what we're describing. And again, I stumble on the name, but the work of the league. And also Lorna has put in a link for the report. It might be the same thing.
That's the same thing. I think we
Okay.
did it simultaneously.
Oh, I love it. I love it. And I have put in, and I hope Arnita doesn't get upset with me, the easiest way to reach her while she's not in the office when she's working at home. And so if you're not able to read the chat, grab your pen. So the best way to get a text message to Arnita is 414-758-0197. And understandably, she's really busy. So I found that texting actually was a good way for the two of us to set up a phone time to meet. Okay, back to Lorna.
So what you said was really important, Arnita, about budgeting. So when I asked that question about the Community Collaborative Commission getting together and talking about all the things you just said, safety is going to be involved in getting healthcare, jobs, education, all that stuff. And every time we talk about it, Barb's co-chair on our committee says that, and where's the money? So what is the will of the Common Council to actually fund all this stuff? And it's not just plans that I've heard Fred say, plans that get made and put on a shelf.
So I can't speak to the specific will of the council around funding it. I think, it's important that if you don't already have relationships with your respective council members and schedule appointments with them, bring them in for your lunch and learn, whatever ways that you can build that relationship to help them better understand your work and the importance of funding and supporting with financial resources, the work that the CCC is doing and the work that you all are doing as a part of the League of Women Voters. I think that's extremely important. I just can't speak to, one way or other what their will is around it.
Thank you. Are there any other friends who would like to make a comment now? Because I want to respect our time. I especially want to respect Arnita's time because I told her 1 hour. I also told that to Gloria. But before anyone else sends their gratitude, I do want to announce that in January, Lunch and Learn is going to be focusing on Ann Terrell. Ann Terrell is the national leader of the National Association for the Education of Young Children, NAEYC, and she also has a diversity equity background. So she will be sharing with us some of the very urgent issues of children. And then the next month in February is Sheila Cochran. Sheila was originally scheduled and then she had a dental problem. So people have been pretty flexible with us, but Sheila is on for February. Sheila recently hosted Gwen's party, her celebration. That's Gwen Moore. And then Gloria Pitchford Nicholas, I'm so happy, is going to be helping us in March. So the same link that you use today is the link that we use every month, and it's always starting at noon. And so friends, unmute yourself. We're going to go popcorn style. I am a little control freak when I'm a Zombie, but this is your time to thank Arnita or to give a message that you're going to take away as she shared the wisdom. So Gloria, why don't you start?
Oh, thank you so very much. And I do appreciate being invited. And once again, Arnita, I thought your presentation was absolutely phenomenal. I'm going to take away the tremendous need to make sure that we are partnering with all of those that are working toward the common good. And in this case, I really think that not only with the mental illness piece, but then also with how do we get those numbers down. We see a significant increase, and we know coming off of COVID, we've got additional problems. So I do love seeing the partnering. So thank you so much.
Thank you.
And I'll read Peggy's. Peggy is the president of the League of Women Voters in Milwaukee County. She's our fearless leader. And her comment in the chat is, thank you so much, Arnita, for a wonderful presentation. You do such important work.
Thank you.
If you're waiting for people to talk or calling on people, so.
No, popcorn style, that means you just pop.
Oh, okay. Yeah, I heard popcorn, we have to call the next person. So anyway, so I would like to thank you as well. And I like what Gloria just said about being partners. The League would very much like to partner with so many different groups in the community that are doing such good work. And I hope that we can make that connection at least immediately with your office through Barb's request about maybe meeting on that report. So, but thank you for everything you do as well.
So Lorna, why don't you get someone to pop?
Okay, I will call on Ann Batista.
Hi, thank you so much, Arnita, for your presentation. I think what I took away is, again, the comment that a budget is a moral document and that we want our budget or we want the budget to reflect the safety, highest priority on safety of people in the community.
Absolutely. Thank you. And we're the same way the CCC is fighting for funding. OVP is always fighting for the adequate resources. And there was a report I put out earlier this year by the Wisconsin Policy Forum that looked at police reform, but also OVPs across, I don't know if they looked in only like Midwest, but at the end of the day, what they noted was that Milwaukee's OVP is both under funded and under capacity. So under resourced, under capacity, not enough people, not enough money, basically.
We can work on that.
Yes.
Okay, I'll just tell you who I see next is Liddy, then Rhonda, then, oh, Mary is ready. So Mary, you call Liddy. Liddy, you call Rhonda. Rhonda, you call Carol. Carol, you call Kathy Osvet, and that will take us through the list. But we have to speed it up because she's busy.
Arnita, I'm so glad I've read about you in the paper, and I've heard great things about you. So it was great to not meet you in person, but Zoom is the next best thing. I seem to recall that there was a fairly sizable amount of money for mental health, either coming from the COVID relief through the state or through the city. Is that something that will come to you as well?
In terms of COVID relief funds or ARPA?
Yeah, it was, part of the, the funds that came from the federal government. I'm not.
Yeah, so it's the ARPA, the American Rescue Plan.
Yes.
Act funds. We had a full request of $16.8 million to expand our work. And so we received $3.27 million from the city. The $270,000 really was to replace funds that were removed from our 2022 budget. And then the $3 million is going to expansion of 414 Life. That was what the city allocated we received half of our overall request. So the 16.8, we received 8.4 from the state. So Governor Evers allocated 8.4 to the state. And so we submitted our proposal to the city, the state, to anybody that would read it. and so that would include increasing capacity within our office, increasing, again, 414 Life, building out, so adding capacity for our suicide prevention work, our youth engagement work, blueprint implementation within priority neighborhoods, so expanding some of that groundwork. And then crisis response healing pieces. We'll do some of that with our recast funds, but then it's not enough. So we also use some of those state funds to supplement some of that work around crisis response and healing. And we're building out our coordinated response. While our goal is our work is primary prevention, we are also in the spaces of intervention and kind of that tertiary piece at times. So we'll be building out our crisis response work that we're already doing, but would do in a more structured and resourced way.
Mhm. And that those funds will stretch out over a period of years, or they'll?
Yes, so we will use them over the course of 4 years. So when you start to break it down over time and multiple projects, it gets a little thinner, but yeah, it's from the state 8.4 million over 4 years. So between 2022 and they would have to be fully expended by 2026.
Thank you. Okay, Liddy, Rhonda, Kathy, and that's it. Because Arnitta's got to go back to work.
Okay, I know. Thanks, Arnitta, for sharing with our group. Thanks for willing to go into the trenches to do the work and make sure you take care of yourself also.
Thank you. Thank you. I appreciate that.
I second what Ms. Liddy said, Arnitta, and just to hear that you said that you only have 7 individuals on your staff was a big wow for me. The work that you are doing is phenomenal, you and your staff. And I thank you so much for not just looking at the youth, but the folks who are in acute need, but you're also looking at intergenerational is what I hear you saying, and it's stretching out into the community, partnering, and we see it. Who would have thought that you only had 7 people in your staff? So thank you so much. Thank you, thank you, thank you, thank you, thank you. Thank you.
Thank you. Thank you.
And
yeah, we're a
sadly,
very
ARPA
small
won't
team.
let her hire people.
Yes.
ARPA will not pay salaries. So I wish we had the money for that too. Carol. I'm not sure she can unmute.
There
Oh,
I am. Thank you very much for your presentation. I most appreciated how you are pulling together so many different kind of strands and bringing them together and trying to also bring in the Milwaukee Police Department and focus on diversity and culture, which then will hit some of the areas that are so important to prevent violence. Thank you so much.
Thank you.
Many thanks. I'm not sure if anyone else was going to unmute, but I think people also had to go back to work or get their projects done. So let me just end with one really quick thing, which is this year we're going to mend a quarrel, seek out a forgotten friend, write a love letter. We're going to share some treasure and give a soft answer. We're going to encourage youth. We're going to keep a promise and find the time. We will forgive an enemy, listen, apologize when we're wrong. We'll think first of someone else. We'll be kind and gentle. We'll laugh a little. We'll laugh a lot. Express your gratitude, gladden the heart of a child. Take pleasure in the beauty and wonder of the earth. Speak your love. Speak it again. Speak it still once again. And so friends, I love you and happy solstice. Merry everything.
Thank you. Thank you all for having me. Happy holidays.
Wow. Thank you, Arnitta.